floor to the distinguished representative of Namibia.
Mr. President, distinguished delegates, Namibia appreciates the convening of this 31st special session of the UN General Assembly as the pandemic has plunged the world into an acute health and economic crisis, the severity of which has not been seen in a century. I therefore wish to thank the NAM under the dynamic presidency of Azerbaijan for this important initiative, and we express our profound gratitude to the PGA for convening this special session to enable us to share with other countries our experiences, practices, and policy measures which we have put in place and to learn from them. Mr. President, the virus and its crisis that comes with it has overwhelmed the fragile healthcare systems in much of the developing world, and Namibia has not been spared some of these effects. In Namibia, we have learned important lessons from the COVID-19 response, including the need for more effective case management of confirmed cases through the use of evidence-based interventions, the need for effective harnessing of our logistical capabilities and capacities, the importance of contact tracing, as well as in the areas of risk communication and community engagement to sensitize the public. The pandemic has also exposed the digital divide, particularly for children in rural areas with no access to online learning when that has become the norm. It is crucial that the international community looks at ways to decrease and eliminate that divide. Mr. President, we have all seen how the COVID-19 pandemic has altered the trajectories of our socioeconomic livelihoods. Human interactions have changed. International trade has been affected negatively. Access to financial markets has been restricted. The demand to borrow money to deal with the pandemic has surged, thereby leading to high debt burdens, especially in developing countries. Some key sectors in our economies are experiencing their worst returns as a result of the pandemic. In Namibia, our tourism industry and our trade is visibly impacted. People have lost jobs and their means to livelihood. The food production has also been impacted, posing a threat to food security. Government continues to balance the health response together with the economic response, and in November, we launched the Tourism Revival Strategy in an effort to revive the tourism and trade industry and to save livelihoods and jobs. These challenges do not bode well for the future of developing countries. The high levels of unemployment, particularly among the youth, could potentially result in massive migration, xenophobic behavior, dissatisfaction with government delivery of services, and ultimately lead to political and security destabilization of some societies. So, President, the Namibian government showed strong leadership and ownership of the situation by activating a National Health Emergency Coordination Committee. We furthermore introduced the Incident Management System and strengthened the functionality of the National Public Health Emergency Operations Center. This center has become the central base from where all COVID-19 responders at the national level are operating from. As a nation, we have had to pivot and adjust in all sectors to the sobering reality of the COVID-19 pandemic. Due to the massive economic and financial losses which resulted from the pandemic, the government introduced an economic stimulus and relief package, which included the Emergency Income Grant, which provided a basic income to individuals out of work due to COVID-19, and a combination of financial tools for the business sector, including wage subsidy, accelerated repayment of VAT, government-guaranteed loan schemes, and various other measures. Mr. President, Namibia commends the World Health Organization for all its targeted efforts in fighting COVID-19. We welcome the great progress towards development, approval, and the imminent rollout of the much-needed vaccines. Namibia wishes to stress that these vaccines, as they get approved, should become a global public good, accessible to all, freely and equitably, and the WHO should lead those processes. Namibia appreciates the various proposals and initiatives that have been developed by different countries and multilateral institutions with the aim of providing assistance to developing countries to help them build back better from the pandemic. It is our hope that these instruments will contribute to the effective implementation of the 2030 Agenda and ultimately to the realization of the Sustainable Development Goals. Mr. President, there is a saying that hope is the anchor of the soul, the stimulus to action and the incentive to achievement. There is also an old African proverb that promises us that no matter how long the night is, the morning is sure to come. For the past 75 years, the United Nations has been that beacon of hope to us, and it has distinguished itself as a champion for equality and unity. At this critical time when we are faced with a multitude of challenges that threaten our future, we look upon this great organization to once again provide the definitive answers to our problems. Therefore, let us embrace one another and pull together in the spirit of multilateralism in the interest of defeating COVID-19, in the interest of achieving the SDGs, and in the interest of safeguarding global peace and the human dignity of every man, woman, and child in the world. Finally, I would like to thank all health and frontline workers around the world who have put their lives at risk to save others for their bravery and commitment. I thank you.